Thank you all for joining us today. As a friendly reminder, please keep yourself muted with your camera turned off to avoid any distractions. You can submit up to 2 questions by chat only. Please submit your questions as clearly as possible and include your name and outlet. Welcome, Madam Mayor London Breed.
Thank you very much, and good afternoon. This has been an incredibly tough year for so many San Franciscans. I've heard from countless residents about how hard this has been. Each of us have our own struggles. You might be a parent trying to help your kids get through school using distance learning, or you're worried about a parent or grandparent in a nursing home, or you're struggling with mental health issues. With everything you've been going through for the past several months weighing you down. And if I'm honest, as someone who basically lives alone, it's been a tough year for me personally. As mayor, I'm always looking for hope, which is why I was so happy just over a month ago to be able to tell everyone that San Francisco has done such an incredible job with COVID that we entered into the yellow tier. I was proud. We were doing well because almost everyone in this city was doing exactly what we asked you to do. But as we said then, this virus is moving fast. Things can change quickly. And now with the numbers rising here and across the state, we are seeing just how fast it can move. Yesterday, the governor laid out a stark warning about hospital capacity in the state. And today, Dr. Caulfax will show what's happening right here in San Francisco. But let me be clear as I can be, it's not good. Cases are spiking, hospitalizations are increasing quickly, our infection rate is higher than it was at a point during the summer. And this isn't just about San Francisco. It's about our entire region, our state, and our country. Even now, as hospitalizations are spiking, we are still taking in transfer patients from other counties because while it's getting bad here, it's even worse in other places. We've been worried for months, but now it's real. Our dangerous winter has arrived. The truth is we are going to have to take more restrictive action, and it pains me to say that. While we are still working out the exact details, we are looking at examples like Santa Clara County, which is seeing alarming case rates increase. They've added mandatory travel quarantines, reduced capacities of businesses, and limited gatherings. These are things we have to consider, as well as other ideas that will help us stop the spread. No one wants to be here. Months ago, we talked about how we worried about doing well, but then having everyone relax and having the cases spike back like they did during the Spanish flu. Now, I'm not saying that's exactly what happened because there have been a lot of challenges with this pandemic, including a lack of national leadership. And a lot of people have done really well. A lot of people in this city have put public health first. But we are now in the most dangerous periods of this pandemic. We need to do everything we can to stay ahead of our hospitals not being overrun. This is about saving lives. Everything we are asking you to do over the coming weeks and months is about that, saving lives. Now, today is World AIDS Day. This is a day where we remember all those we lost to the HIV/AIDS epidemic and recommit ourselves to our efforts to get to 0 new HIV infections. It's important in times like these where we are staring down the difficult months ahead that we remember what we can do when we band together. A lot has been said about San Francisco, building on our efforts to fight this COVID pandemic by reaching back to our history when we had to confront the AIDS crisis without any support. The trust we built then between our residents and our public health officials, neighbors coming together as so many people got sick and died, those are hard memories, but they show the spirit of this city, a resilient city, and the resilience of the people who live here. So today, on World AIDS Day, as we remember the history fighting HIV/AIDS, let's remember what we can do. Because I know people are trying. I know people are tired. I know it won't be easy, but I believe in this city and I believe in all of you. Finally, today, I want to take a moment to talk about the budget situation at the SFMTA. From the beginning of this pandemic, it has been my goal that we not lay off any city workers. We were able to do that in our most recent 2-year budget, but we know that we have a long road ahead of us and we still have a lot of tough choices to make. The MTA is facing a deficit of over $230 million in the next 2 years. Without more emergency federal funding, closing this deficit may require laying off between 18 and 22% of MTA's workforce. The possibility of losing nearly a quarter of our workforce at MTA is hard to imagine, but this is the reality we have to confront. We are facing the gutting of a basic city service that our residents rely on and that our economy needs to recover. And just as importantly, this would mean bus drivers, mechanics, and other dedicated city workers losing their jobs and their ability to provide for their families. San Francisco is not alone here. Cities across the country are facing this same public transportation crisis due to COVID-19. Just yesterday, Washington, D.C. announced that its metro service was going to have to lay off workers, eliminate weekend service, and close stations. Federal CARES Act funding helped keep munis stable during the first year of this pandemic. And as we push for more federal support in the weeks and months ahead, transportation must be our top priority, along with support for our small businesses that are suffering. A decimated transportation system will hobble our economic recovery in our city for years. I'm hopeful that the Biden administration will work with Speaker Pelosi and Congress to provide emergency support. There are some steps we can take locally to increase MTA's revenue and save costs in strategic ways, and we will do what we can within the city. If there are other ways to help fill this deficit, we have to consider every possible way. Muni is in deep trouble, and we need to do everything we can to save it. Now I'd like to turn over the rest of this time to Dr. Grant Caulfax from the Department of Public Health to provide you with clarity around the numbers, where we have come from, where we're going, and what we need to continue to do to get our city to a better place. Dr. Grant Caulfax.
Good afternoon, and thank you, Mayor Breed, for your ongoing leadership of our city during this unprecedented time. And thank you for recognizing World AIDS Day, a virus that claimed the lives of so many of San Francisco's residents. I am going to get straight to the point because with the speed that COVID-19 is spreading throughout the city, the region, and the state, we literally have little time to spare. Unfortunately, and as the mayor mentioned, we are in the middle of a major surge that is threatening to overwhelm our healthcare system, as well as the healthcare systems in the surrounding counties and the state. All of us must be considering the risk of our own actions in our day-to-day lives. And let me be frank, the actions you take or don't take can impact you, your family, your friends. It's that simple. We are all at risk for this virus, and we all need to take precautions. And while it's uncomfortable to think about, and we certainly hope that it doesn't happen, consider this. If you or a loved one becomes very ill from the virus, will there be a hospital bed to treat you or to treat your loved one? We are seeing people in communities across the country grappling with this very issue right now as COVID-19 continues to wreak havoc on healthcare systems in communities big and small, urban, suburban, and rural across the country. This past weekend, nevertheless, we saw tens of thousands of people fly, drive, and gather with extended family as the virus ran rampant throughout the country. As a result of these holiday-related activities, we know, unfortunately, that the worst is likely yet to come. And together, we will have to take appropriate measures to keep all San Franciscans as safe and healthy as possible. So let's review some of the data that has us so very concerned. Could we have slide 1, please? This slide shows the number of cases of COVID per 100,000 in San Francisco from the beginning of the pandemic in the early spring to now. This slide shows how quickly our cases have multiplied in the last 3 weeks. In the last 3 weeks, San Francisco's positive cases had tripled. And we do not expect this to stabilize anytime soon. We have more virus circulating than ever before. Think about what this means and how we must act accordingly. San Francisco passed 16 cases per 100,000 residents on November 22nd. That was our highest case rate to date. The case rate has been climbing since October 22nd, when San Francisco had an average of 34 new cases per day. 34 new cases today. Now, San Francisco has an average of 140 new cases per day. That is 4 times more new cases than just 1 month ago. That is how fast the virus is multiplying throughout our community, and it shows no signs of slowing down. And yet, we are still in a highly volatile position, more than at any other point in the year. We have yet to account for travel and gathering from Thanksgiving. Next slide, please. Unfortunately, we know that a spike in positive cases results in an increase in hospitalizations. And this slide illustrates just that. We are now feeling the pressure of the rapidly accelerating cases at hospitals across San Francisco. In fact, COVID positive hospitalizations have doubled in just 10 days. Consider this. We went from 40 hospitalizations on November 18th to 87 on November 28th. In addition to the 87 COVID patients in San Francisco, there have been 4 COVID patients transferred to San Francisco hospitals and other jurisdictions, totaling 91 patients with COVID in our hospitals as of November 29th. Unfortunately, if we continue on this path, we, as well as other Bay Area counties, will start seeing a hospital bed shortage. If this trend continues, we will see a hospital bed shortage around Christmas. That is a sobering thought. San Franciscans sick from COVID-19 during the December holidays, with the real possibility of no available beds at our local hospitals. Of course, we hope that this doesn't happen, but it is an increasing likelihood as we see this virus spread locally like never before. We can remove this slide. So San Francisco, we've beaten back 2 surges. And again, we need to beat back this 3rd surge. Simply put, we need to slow the spread of the virus. In recent weeks, we have taken a number of actions to try and slow the spread. We have halted indoor dining. We have closed indoor museums, non-essential offices, indoor gyms, and zoos. We have limited capacity at essential indoor services. And just yesterday, we were required by the state to abide by the limited stay-at-home order, requiring all non-essential activities to stop by 10 p.m. But none of these actions during the past 2 weeks have slowed the rate of the spread of the virus. In fact, infections have continued to increase. Therefore, we will be implementing additional rollbacks and restrictions to temper the virus. We are going to further reduce the number of people who can gather, especially from multiple households. And we will be analyzing the capacity restrictions for indoor shopping and other indoor services. We are reviewing the Santa Clara County Health Order requiring those who travel more than 150 miles to quarantine for 14 days. Some of this new guidance will be issued this week. We must slow the spread of this virus, or we will continue to see hospitalizations and unfortunately death rates climb, possibly to numbers that we have never seen before. Numbers that will overwhelm our healthcare system and tax our frontline workers. We will become one of those cities that has struggled to deal with the virus in ways that we, thankfully, have not yet had to. It is not inevitable. We can slow the spread. It will not be easy, and everyone has a part to play. I am that broken record and will continue to be if it saves lives, keeps people from getting sick, hospitalized, and dying. Please do not gather outside of your immediate household, especially indoors. Please stay home if you are sick. Wash your hands. Wear that face covering. You know, as a gay man and as a physician who trained here in San Francisco during some of the most severe days of the AIDS epidemic, every World AIDS Day, I think about the lives we could not save. So many of us lost family, friends, neighbors, and colleagues. We could not save lives because we did not yet have the tools to treat AIDS. But we came together as a city and worked together to find solutions. With this pandemic, we already have the knowledge. We know what it takes to fight the virus. This current surge should not cost us family, friends, neighbors, and colleagues because we know what to do, what we need to do to protect lives. Please, let's work together. Let's come together to protect lives, to protect our communities, and to protect our city. Thank you.
Thank you, Dr. Caulfax. At this time, we'll begin the Q&A portion with Mayor London Breed. Thank you, Madam Mayor. Your first set of questions come from Megan Cassidy with the San Francisco Chronicle. How would you respond to the mentions of Naomi Kelly in the complaint against Harlan Kelly, and have you considered asking her to resign?
Just so you know, we are still reviewing the allegations made by the U.S. Attorney. These are very serious charges, and while people, of course, are innocent until proven guilty in a court of law, the actions are deeply troubling. I've said from the very beginning of this investigation that we need to do everything we can to restore public trust. We will continue to consult with the City Attorney's Office about our steps forward, and I want to reiterate that everyone should cooperate with any investigation, whether it's by the U.S. Attorney's Office, the City Attorney's Office, or the Controller's Office.
Thank you, Madam Mayor. And lastly, from Scott Budman with NBC, do you have any comments about reports that more San Francisco restaurants will have to shut down or, quote, hibernate?
Well, I think that what we have tried to do from the beginning of this pandemic is to provide the facts about every situation. And as soon as there is information we can provide to the public, we make sure that we notify the public. And as soon as we think that there might be the possibility of any closures, we try to reach out to people and reach out to that industry. We have been in touch with the Golden Gate Restaurant Association and many restaurants who, of course, are naturally concerned as we see a spike and as we see places like LA County close outdoor dining entirely. So I want to be clear that unfortunately we can't rule it out. And as soon as we think it is absolutely necessary, based on what we're seeing with this spike, based on what we are seeing with hospitalizations and the direction that our city is headed in, it could be a possibility, but we can't say right now what that would mean in a timeline, but we will do everything we can as soon as we know when or if it happens. We will make sure that we provide as much notification as we can, understanding that we're not just talking about the owners of these restaurants and places for people to go. We're talking about the food that they're ordering to prepare. We're talking about the workforce they've had to bring back, people who were probably on unemployment, and then they're off unemployment, and then it takes forever to get back on employment. So we understand the challenges that people are facing. And our goal is to make sure that whenever possible, we do what we can to provide as much information. And it pains me every time I have to do a press conference where we have to talk about rollbacks. There will be rollbacks. There will be announcements even this week, because we know that we expect the state of California to impose other restrictions on San Francisco. And there may be further rollbacks that we put into place ourselves in order to curb this virus. So we know that that's to be expected, which is why we have to continue to do our part to distance ourselves from one another and to limit our activities because we've done it before. But what we're seeing now is a spike unlike anything we've seen since the beginning of this pandemic. We are in trouble and we are sounding the alarm, as I said before. So that's going to mean some real challenging months ahead.
Thank you, Madam Mayor. We'll now transition over to Dr. Caulfax for a variety of health-related questions. Dr. Caulfax, the first set of questions come from Aaron Alday with the San Francisco Chronicle. What is the timeline for issuing new rollbacks, and what is going to trigger the new orders? Is it possible we'll be seeing another stay-home order like the things from March?
So as we mentioned, we are reviewing a number of options, including limiting outdoor gatherings, limiting capacity of indoor activities, looking at the Santa Clara travel order, quarantine order, and some of these orders could come out as early as tomorrow.
Thank you. And from Julian Mark with Mission Local, study after study, and even your own data, show that the Latinx population is seeing higher infection rates than the rest of the city. As we enter a surge, is there a strategy going forward to offer more widespread testing and resources to the people who are getting sick?
Yeah, so since the beginning of the pandemic, we have focused on the equity-related issues that this pandemic has brought forward, and have been very focused on the fact that as across the country, statewide, regionally, and locally, the COVID-19 infection rates are disproportionate among Latino populations. That's why at our COVID Command Center, we have engaged the Latino community from the very beginning, invested in testing, isolation, and quarantine rooms that are made available to people free of charge, invested in food security, contact tracing, and healthcare. We're working with multiple Latino organizations to strengthen our Latino strategy, and our testing work has increasingly concentrated in the southeastern part of the city. We now have a city test SF site at Alamany, at the Alamany's Farmer Market site, Monday through Friday. We've expanded pop-up testing in the southeastern part of the city, including the Excelsior, OMI, Potrero, Bayview, and as well as the Mission. And we continue to partner with UCSF and community partners to ensure that we provide testing. Just in these last couple of weeks, we've conducted hundreds of tests at transport hubs that have really focused on engaging, on supporting Latinos who are most likely affected by this pandemic.
Thank you, Doctor. The next question is from David Baker with Bloomberg News. How do you intend to keep people from gathering in groups, since many people have ignored the city's prior request to stop gathering?
So I appreciate, so we are working to continue to emphasize that gathering with members outside of your household is dangerous. It increases the likelihood of the transmission of the virus. So our goal is to really continue to educate as much as possible, and to ensure that people understand the risk and understand that it is against health orders to gather in ways that could promote the transmission of the virus. And I think that what we really need to do is focus on the educational aspect of this, so that people understand that this virus can and will affect them and their family members, and that we need to just dig deeper and really do the things that we know prevent the spread of this virus as much as possible. And we will continue to enforce city guidelines and rules as necessary to prevent major spreader events as much as possible.
Thank you. And lastly, from Dan Kerman with Cron 4. What rollbacks are you looking at and what is the timeline for it?
So I believe with regard to one of the prior questions, we again are looking at reducing capacity of indoor activities in certain institutions and businesses, further limiting the size of group gatherings, looking at potential travel quarantine orders. And again, some of these orders could be issued as early as tomorrow.
Thank you, Dr. Caulfax, and thank you, Madam Mayor, for your time. This concludes today's press conference. For any follow-up questions following this meeting, please email dempress@sfgov.org. Thank you.